For more than 3 months, the NBC6 investigators have been surveying healthcare workers across South Florida, getting their reaction to the coronavirus crisis in real time.
And as new cases continue to mount, their concerns about reaching hospital capacity are growing. So is their lack of confidence in some that are in charge. Here's NBC6 investigator Tony Pipitone with the latest.
More than 300 frontliners have participated in our ongoing survey. Back in May, some were saying they thought they had seen the worst of the pandemic. But our new results show that is no longer the case. It's a reality we were warned about. Coronavirus cases going up, ICU beds filling up, curfews and lockdowns coming back.
Unfortunately, we're back to square one, I believe.
ER physician Jorge Infante says the percentage of patients testing positive for the virus at his facility is higher than ever.
If you're seeing a lot greater numbers of people getting infected, just by sheer math, you're going to start seeing more complications. So we're seeing sicker patients.
As concerns grow among frontliners, more are questioning the actions of authorities. In the May survey, 64% say they were doing enough to keep us safe. That's now down to 39%.
And I don't know how much shutting down we got to do, but we got to go back to the strategy that we have to dampen this curve.
Martha Baker, union chief for Jackson Health System workers, has been raising the alarm for days as the number of ICU beds available continues to shrink at the hospital, with nearly 90% occupied today.
You know, it's tight. It's patients are being taken care of, but it's stressful on the staff right now. And it's bordering on getting dangerous if we continue to peak.
Nearly 90% of those who participated say their workplace has seen an increase of infected patients. About half say there are enough resources to deal with the surge, but more than that have a great deal or a lot of concern they will reach capacity.
I don't know if it gets worse where the patients are going to go.
Registered nurse Rublas Ruiz says COVID patients are quickly filling up ICU beds at Kendall Regional, and there are not enough nurses to treat them.
A lot of our nurses and healthcare workers in general at our hospital have been infected with the virus and not being able to go to work. And that has affected our staffing.
Usually, he says, there's one nurse for every 2 patients. But now?
Given the fact that nurses are getting infected and out of work and all this craziness going on, so we're taking 3 patients.
The state today says Kendall Regional's ICU unit is about 90% full. Now, the hospital tells us they do have a plan in place to deal with the surge. Those who answered our survey are asking leaders for more contact tracing and testing and a clear message, something they say they haven't seen lately. Reporting in Miami Beach, Tony Pipitone, NBC6 News.